LauraEllen Ashcraft is an implementation science methodologist and assistant professor of epidemiology at Penn, and wonderfully for us, are one of our co-leads of our AMETHIST Penn Design Core. So thank you so much for being here with us today, and I will turn it over to LauraEllen.
Thank you, Casey. Thank you, everyone, for coming out on this Friday. If you would you put in the chat, I feel like titles can be a little bit, but just kind of your role and how you're coming into this space. So for me, I'm an assistant professor. I've been doing research for over 10 years now, but have been an assistant professor for a little over a year. And so if you want to share that in the chat, just to help give me a little bit of context, I have it up here. And as we get going. So today we're really going to be talking about manuscript writing and what this looks like kind of broadly for the biomedical literature, but then specifically thinking about what this means for implementation science journals. And it can be a little bit of a tricky thing for folks who are newer to implementation science to think about, okay, how do I get the findings that I have from my study into an implementation science journal? And I'm seeing all of your wonderful, okay, so we have some staff here, we have trainees. Hi, Ms. Deborah, so good to see that you're here. Training coordinator, great. Oh my goodness, Jess, thank you, Dr. Olson, very much appreciate that. Okay, this is fantastic. So we have quite a range of folks. And so I'm so glad you're here. Please put your, like Casey said, please put your questions in the chat. We'll try and get to them. We'll also have a discussion at the end. All right, so let's get started. So this seminar really originated out of this idea that we at AMETHIST are here to help you. And so one of the things that came across our desks and via our email was this idea of, okay, I'm newer to implementation science. I want to publish in the implementation science literature, but I'm having trouble doing that. So can you give some guidance? And so certainly we are here to provide support to you, whether you're an investigator or trainee affiliated with one of the Improve Initiative Centers of Excellence, and we're bringing up support for the SIPs as well. And so we wanted to think about, okay, how can we provide some broad guidance before we dig into individual level guidance? So this is our agenda for today. So I'll give you kind of an introduction to myself for folks who haven't met me before, some disclosures, and then we'll get right into how I really think about publishing in this space. As Casey mentioned, my name is LauraEllen Ashcraft. I am a social worker by training. I find social work to be an incredibly useful way to think about the world and engage with the world. I also recognize that the field of social work has done a lot of harm, especially in historically marginalized communities. And so I recognize that harm and recognize that we need to promote justice and restoration in those communities. I'm also an implementation science methodologist. And what that means is I think about implementation science all day, every day. And I think about the ways that we can improve our field of implementation, how we can better promote health equity and justice. I'm also a first-generation academic. I'm the first person in my family to have a PhD, to have a doctorate. And so I bring that perspective to our conversations today. Here are my disclosures. I do have, I receive funding from the U.S. Department of Veterans Affairs. Of course, everything I say today, none of it is representative of the views of the U.S. Department of Veterans Affairs or the federal government. These are my own views. I also have funding through the National Institutes of Health through several projects. And coming into this work, specifically thinking about implementation science, there are many lenses through which I think about the field of implementation science, many of those anchoring on diffusion of innovations theory and these other theories, models, and frameworks that we so often love to talk about. I also have here listed my professional mission statement, which really helps guide the work that I do. Okay. So kind of the overarching caveat and also just kind of a disclosure, I think, is that this is based on my own experience publishing in the implementation science literature. So often the papers that I work on primarily go to implementation science journals. So my first author papers, many of my senior author papers go to implementation science journals. And so I'm here to talk about that experience. I am also an early career investigator, so I haven't been doing this for so long. And so I bring that as well. I'm likely missing a lot of things, and my experience is likely different from yours. And so let's have let's have a conversation. And thank you everyone for bringing in and putting in your roles and how you're coming to this work. So excited to see you all here. Okay, so let's talk about kind of the first stage in thinking about publishing in the implementation science literature. How do we start? So let's think about those kind of early process or early considerations. So some of the considerations that I like to think about when I have finished up a study, I have these data, I have these results. Okay, I want to communicate that information, right? That's a lot of what we want to talk about. And so I really think about who are your audience, what are your incentives, and what are other possible dissemination channels. We'll talk a little bit more about once you get a published paper at the end, what are other ways to communicate and share about your published paper. But I think thinking at the beginning, is a peer-reviewed publication the best way to communicate your results to reach your intended audience? And we don't have time today to go into dissemination of research or science communication, right? That's a whole other field. But really thinking about, okay, what is the information? Who are the people that I'm wanting to reach? And then what are the incentives that I have? And so one of the things that I think about a lot, so I am an academic, right? I'm an assistant professor. And one of the things for me, one of the incentives that I have is that it is beneficial to me and to my job, right? It's going to help me keep my job in the future for me to publish in the peer-reviewed literature. And so it makes sense, right, that I would put resources and energy into publishing the peer-reviewed literature. That may look different for you, right? As community partners, what are the best ways that we can reach out and we can engage with our community partners? Maybe that's a peer-reviewed article, although most of the time, right, maybe we think that may not be the best way to reach them. And so this is something I would really encourage folks to think about kind of from the outset. Who are the people that we want to reach? What are the incentives that we have? Because whether or not we agree with the incentives that, right, as an academic, as a faculty member at Penn, I am, part of my role is publishing literature, and kind of independent of how we feel about that, I think it's important, and from my perspective, it's important to at least acknowledge that those are the incentives that exist. And so then thinking about, as I mentioned, right, who are the people who you want to receive the information that you have, the results that you have? And so thinking about, is it other academics? Is it kind of the general audience? Is it the community partners? And I think thinking about this at the beginning can then help you to decide, right, is a peer-reviewed article the best option? Maybe it's an op-ed, which we'll talk about some of our resources that exist for writing op-eds at the end. Is it something else, right? Is it creating some kind of YouTube short? Who knows kind of where TikTok will be for the long term, right? Is it kind of creating some kind of video platform via social media? Who are your intended audiences? Again, thinking about these incentives, right? Acknowledging that tenure and promotion is a real thing that academics face and want to engage with. Maybe it's connecting, you're working with a social services agency or a nonprofit, and you want to update their board members who gave you permission to engage with the people that they serve or to engage with their staff, right? Then you want to update their board members. Do you want to communicate with the general public, or is it about informing other scientists? And then digging into what are different ways that we can communicate that information. We're going to be talking about peer-reviewed publications, and then certainly there are other resources here within the Amethyst group, thinking about social media, thinking about letters to editors. Maybe it's a policy brief. That could be a really compelling way to engage with policymakers at the local, state, or even at the federal level. Maybe it's a summary report, right, that you provide creating some really nice visuals, right, and provide to your community partners. I think that can be really powerful as well. And thinking about the times that myself as a community member, and when I put my community member hat on, have engaged with consultants or things like that, right? Having these summary reports describing the work that they've done has been so, so useful to me. And so make sure your needs align with the peer-reviewed literature, right? So the peer-reviewed literature often is most targeted toward other academics, right? You don't necessarily have your policymakers reading peer-reviewed literature, and if they are reading it, to what degree they're fully understanding it is, kind of up for discussion. I think sometimes, depending on their background, if they're a full-time, part-time legislator, all of those kinds of things. Thinking about your incentives, you have, right, as academics, we have incentives for promotion, for tenure, for getting our name out there, right? These things all factor into the incentives that academics have. Now, you might not be an academic, and that's totally fine. So thinking about what are your incentives. If the peer-reviewed literature is not the best way to get your results to the audience for whom you want to reach, then really think about, is this the right option for you? And thinking about this ahead of time, right, before you go through the very long and stressful process of trying to get something in the peer-reviewed literature can really help save you a lot of grief. Okay, so let's dig into finding the right journal. So I will kind of say that, let me back up a little bit. I will say that as I was preparing the presentation today, thinking about your journal versus your content and which topic should come first was a little bit, it felt a little chicken egg situation. So we're going to start with journal and then we're going to go to content, but just know that, maybe it could or should be flipped around, but just so you know that. Okay. So there are many types of journals that are out there. We don't have time today to go into, predatory journals, those kinds of things. Folks who are working as part of one of the improved initiatives, COEs, you have access to, or you should hopefully have access to, some kind of academic library system. Typically, the librarians at those systems will have plenty of resources thinking about how to identify and protect yourself from predatory journals. If you don't have access to that, please let us know. And certainly, we here at Amethyst can pull some resources from the Penn Library and pull that up for you. So when I think about publishing research as it relates to implementation science, there's kind of two big buckets of journals. And these are the academic peer-reviewed journals that I'll be talking about for the rest of our time today, that I really think about. So there are the topic-specific journals, and then there are the implementation science journals. So let's talk a little bit about what kinds of things tend to, right? These are broad generalizations, but these are the kinds of things that tend to show up in these two different buckets of journals. So when you think about your topic-specific journals, these are your clinical findings. These tend to be your effectiveness outcomes, which we'll get into content in the next section. You can see why this is a little chicken egg, but these are, we saw a reduction in infant mortality of this, this degree of reduction over this period of time, right? Those tend to go in topic-specific journals. Also, articles and results that are talking about findings specific to your innovation, evidence-based practice, or evidence-based intervention, whichever term, I use those terms synonymously, but things that are specific to the innovation itself will typically go into a topic-specific journal. Very rarely, if ever really, do I see these types of articles being published in the implementation science literature. And so if you have some kind of clinical finding as it relates to postpartum care, right, you would probably want that to go to more of a maternal health journal rather than an implementation science journal. And you could say, okay, that's great, but then what gets published in the implementation science literature? So, what tends to get published in the implementation science literature, and we'll talk about in the next couple slides here why this is the case, but what tends to get published most often are the results from large, very large implementation science trials. So, these could be trials that have hundreds of participants, if not thousands, at the patient level, or providers, if the providers are your target participant, at many different um, medical centers. And these are the implementation results from those large trials. We also see advancements in implementation science methods, although as methodologists, I have found this to be a little bit of a tricky thing to identify the best way to frame this, but that's a bit of a different conversation. But really thinking about, oh, we are proposing a new way to measure fidelity as an implementation outcome, and we have validated this instrument for measuring fidelity. Those kinds of things will go in, especially the top implementation science journals. If there are, again, this goes back to the trials, but if there are large tests or evaluations of implementation strategies, so the most common taxonomy is the ERIC taxonomy of implementation strategies, and more common thinking about implementation mechanisms, these types of evaluation papers go in the implementation science literature. These are the kinds of things that in 2025 and in the past couple years, implementation science has been really interested in. I want to put this out there because I see this quite a bit, is most of the implementation science journals are no longer publishing barriers and facilitators papers. And so when we think about barriers and facilitators, another way we think about that is, another word that we use are determinants, right? Thinking about what are the factors that get in the way or support the implementation of your evidence-based practice, your innovation, your thing, using Jeff Curran's language, within your given setting. The field has moved past that. And so what I'm seeing more and more is if folks are wanting to publish a determinants paper, a barriers and facilitators paper, that tends to now go in the topic specific journals. If you look historically at publishing and implementation science type journals, you will see lots of these papers when the field was a little bit younger, but those are no longer being published and being accepted. So if you submit a barriers and facilitators paper to one of the top implementation science journals, it will be just rejected. One of the tools that it feels a little antiquated these days, but it's like an oldie but a goodie resource, is Jane. I don't know if folks are familiar with Jane. I was told about this before my PhD program, so a long time ago. But what it does is you can put your title or abstract. I like to give it as much as I have. So for example, one of the things that I often will do is if I put, oh, great, okay, Sophia loves Jane. Thank you, Sophia. If I have written up a conference abstract, for example, but haven't gotten to the point of writing up the paper, and if I don't know where I want to send it, I will throw it into Jane, and then it will show something. So I would encourage you to play around with this. Definitely, you're not going to want to do this during my very riveting talk today, but this can be a really nice tool. You can, I know this is a little blurry, but you can search by journals. So you can find journals that have similar articles and keywords associated with whatever text you put into the box. You can also find authors. So if this can be a really great way if you're struggling to think of who to recommend to review your articles. Sometimes journals will ask for that. You can do it that way. You can also find other articles like, oh, I am publishing, some paper about fidelity. Let's go with our fidelity example. What are some other articles that also have the same kind of flavor to it? Maybe you're more interested in how they introduce their argument or their research results. And so this can be a really nice way to do that, maybe you can give it more information than if you were just searching on Google Scholar or PubMed or something. So Jane is an excellent resource. So here are I guess there's 5 here. Here are the 5 most common implementation science journals. As you will notice, there are only 5, which gets a bit into one of the challenges that comes with publishing in implementation science. We will provide the slides. I did include the hyperlinks here just so folks can go to them, or you can Google them very easily. So I'll just walk through these briefly and give a little bit of a primer on each of them. So implementation science is the top journal in the field of implementation science. This is where all the big major papers are published. Several years ago, implementation science introduced or kind of had a sister journal called Implementation Science Communications. Implementation Science Communications will accept, although this is, again, there's only 5 journals. So, but Implementation Science Communications tends to accept trials that are a little smaller or methodologic advances that maybe the data supporting that advance are a little smaller. So implementation science communications, same publisher, sister journals, both increasingly hard to get into. Implementation science is very hard to get into. They are, more these days, they are publishing, again, the results of very, very big trials, systematic reviews, meta-analyses, those kinds of aggregating papers. We then have Implementation Research and Practice, which is the journal of the Society for Implementation Research Collaboration, or SIRC. The Implementation Research and Practice journal tends to be more behavioral health, mental health, substance use disorder focused. So very much kind of has that bend to it, and practice focus. So this is really looking at engagement with communities and really, but very much the behavioral health side of that and less the physical health side of that. GIRA, which is the Global Implementation Research and Applications journal, is, I think, the newest of the 5. They do publish US-based papers. They tend to be kind of more open and really are wanting to publish implementation science with a global lens to it. And then I know, as I have kind of been in this role a little bit longer, people have opinions about Frontiers, kind of as a publisher in general. But Frontiers in Health Services does have an implementation science theme or topic. I forget exactly how they frame it. I will say that there are some really good papers that are really good implementation science papers that are published in Frontiers. And I think one of the reasons for that is, as you can see, and as I've mentioned already, right, there are only 5 journals. And I think 5 years ago, maybe only 3 of them existed, right? And so this is very much one of the challenges is a supply and demand issue. So implementation science, as I've mentioned, is increasingly hard to get into because there are so many papers folks who want to publish papers in the field of implementation science. And because of the high demand, implementation science and increasingly implementation science communications are getting increasingly picky and really selective, which, I have various feelings about that. And so one of the questions that came in as folks were registering was how much to think about impact factor when it comes to implementation science journals. I think this is a little bit of a tricky thing because it goes back to who is your audience and thinking about are you attempting or working to publish an advancement in implementation in the field of implementation science, or are you thinking more about that clinical topic of we made a difference as it relates to this clinical topic, whereas the novelty here is something about the implementation methods, if that's making sense. And so implementation science, well, all of these journals are relatively new. I was looking up the impact factors when this question came in, and there's so many different metrics these days for impact factors. I think implementation science was at like an 8.8, maybe was their 5 year. But you know, it's really hard. So I personally don't tend to think too much about impact factor. But I also can understand, right, when again thinking about our incentives, right, one of the criteria when you're going up for tenure and promotion is really thinking about where did you publish those papers, right? Were those papers in the top journals? And so when you're thinking about the field of implementation science, if you're implementation science is the top field in the journal, kind of independent of its impact factor. Yes, I would say probably of all the five here, it has the biggest one. So all right, so we've talked about the journals. Let's talk about thinking about the content, and I've been alluding to this a little bit, and like I mentioned before, right, this could have gone either way, right? We could have talked about content for the journal, but here we go. Okay. So when you're thinking about your content, you say, okay, I have I've done this research study. I have these results. I now want to publish this in the peer-reviewed literature. I want to communicate with other academics about the work that I've done. How do I figure out what to do? So one of the things that I choose to believe is that the journals want you to succeed, and maybe not the journals themselves, the publishers. I mean, the publishers definitely want you to publish in their journal, but editors, I have found, I think especially in the I think I have this on a later slide, but editors want you to succeed. And so look, there's certainly formatting, and we'll get into the kind of nuances of the implementation science literature in a couple slides here, but really looking at the instructions for articles, find similar articles that are published in the journal that you are interested in publishing in. So one of the things I will often do is I will say, okay, I want to publish this paper. I want my first, for me personally, right, like my first journal that I always go to is implementation science. So, okay, I have this research idea or these research results. I want to publish it in implementation science. I'm then going to go to the implementation science website, and I am going to look for articles that are similar to mine in, are they a methods paper? So implementation science has a methodology article type, and so are they a methods paper? Okay, great. What are some other recently published methods papers that maybe I can format and frame my own paper in a similar way? I am a big believer in finding something that has been published that's similar in the last 6 months, depending on the journal. But implementation science journals tend to publish almost continuously, and so finding something that's been published in the last 6 months, looking for a similar article type is what you want to publish, and then looking at their headings, right? Make sure that you are also including the information that they have in their article in your article. There are some unspoken rules around publishing and implementation science, and as someone who is doing more and more peer reviews, which I very much enjoy, I love hearing what other people are working on. We have some unspoken rules, and so I'm going to make them spoken. So please, I know many of the folks on here, we've done consults with you through the design core, which we're here to do more consults, but please report what framework you are using and how you're using it and how you actually integrated it into not only your data collection. Okay, we use CFR to help construct our interview guide. Okay, how did you use CFR in the analysis of your qualitative data? So really being clear about what framework or frameworks you used is really important. Then I don't have it quite here, but then in the discussion section, I have been encouraging folks more and more critique the framework, right? Critique the and not in a mean-spirited way, but saying, hey, CFR has its limitations for this particular context, and these are ways that we addressed it. Enola Proctor has published several papers about reporting implementation strategies. I strongly recommend, it's not a requirement, but it should be, in my opinion, to report any implementation strategies that you're using the Proctor criteria. There are unlimited tables that you can have, or additional files. So please report your strategies using Proctor. When you're thinking about your implementation outcomes, please use the common terms. Please use the common definitions. Maybe within your own study, you called fidelity something different because that's what your community partners really resonated with. That's fine. I truly, you can do whatever you want within reason, of course, but you can do what you want, like within your own study team. When you are publishing in the peer-reviewed literature, please, for the sake of your readers, for the sake of the editors, and the reviewers, you really want to use common terminologies, common definitions, include those citations to make sure that people are understanding what you're wanting, what you're trying to communicate. If you are doing any type of hybrid trial or doing some kind of smart trial that is used commonly in implementation science, please use the common descriptions and naming conventions. So their implementation effectiveness hybrid type 1, 2, 3, whatever that looks like. Really would encourage that as well. There are plenty of citations I can send you on that. And then increasingly, journals are asking for using reporting guidelines as an additional file. And so STARI is one that is used in implementation science trials. And so would encourage folks to use that as well. So what do you put in the results? And so this is something really thinking about where, and this kind of goes back to, is this where to send your article? And so one of the things that we think about in the field of implementation science, thinking about what is going to get published in this field, is thinking about, do you have a novel approach to implementation study design? So was there something that is relatively new about the way in which you constructed your implementation the study itself? Or is there something that is new about how you thought about implementation strategies or how you identified implementation strategies, right? Maybe the strategies themselves that you used aren't the new thing, but the way in which you worked with your community partners to identify what strategies you would use, that is new. And so, that is helpful as well. Has there been an implementation study on this clinical topic before? So really thinking about where this should go. And this goes back to, does it go in an implementation journal or does it go in a clinical topic journal? And so one of the other things like this also can go back to impact factor. Maybe if there has never been an implementation study in your given clinical topic before, you may get into a higher impact, a higher caliber journal if you go the route of reporting your results in your clinical topic area versus in the implementation science area. So that's something to think about. How many sites do you have? I recognize and I can hear what I'm saying, that it's like, well, if you're not doing a big trial, or if you're not, if you don't have, 25 sites, then you're not going to get published in the literature. And certainly when it comes to the journal implementation science, that may be true. And again, it's much more of a supply and demand thing. But I think really being honest with yourselves, because you can save yourself time and kind of I was going to say pain, but frustration, I think. Um, and is your work, and this gets back to deciding kind of what journal, is your work considered novel or new, right, in your clinical space? Is there something novel or new about your intervention? Or is it more considered novel and new about the implementation methods and aspects that you used? And so, if you choose to go with a clinical journal, which I think really makes sense, you may need to explain a bit more about the implementation science aspects of your project. So really being really crystal clear in your terminology, the definitions, right? When we say fidelity, this is what we mean. When we say adoption, this is what we mean, right? Thinking about implementation outcomes. And even so far as when we say implementation strategy, this is what we mean by an implementation strategy, and this is how an implementation strategy is different from our evidence-based practice or innovation. Oftentimes, and I've been a part of a couple of these types of papers, there is a short report or letter to the editor. It kind of depends on the journal. There's some kind of editorial about, we need implementation science in XYZ field, and here are the ways that implementation science can support the wonderful work that we're already doing in this clinical field. Again, I feel like most of these papers have been written to some degree. They may not be in your specific topic area, but I would encourage you to look for this type of paper specific to your clinical area, and then look at how they, what citations did they use, what terminology did they use about bringing implementation science into your clinical field, and certainly reference that and cite that. And I really, I think this is one of the challenges that I sometimes have as a methodologist, is I want to make it super complicated, but I think especially when it comes to some of these clinical journals, in thinking about the aspects of your implementation science, study design, or rationale for doing things, it can be really helpful to just keep it simple. Keep it simple when it comes to the implementation science side. Make sure you're defining things, make sure you're being clear, but certainly keep it simple. If you are publishing in the implementation science literature, implementation science journals and reviewers are very used to seeing all kinds of clinical topics. So, and seeing things from kind of all over the world also. So it's like kind of geographically agnostic as well as kind of clinically topic agnostic. And so oftentimes it is okay to say, this is a problem that exists. This is our innovation or evidence-based practice to address the problem. But because of this thing, we fail to use this intervention to address this problem. And most of the time it can be said, I have it written here as, what is that, 3 sentences. Most of the time it is 1 paragraph. It is, maybe 3 sentences, maybe it's 4, maybe it's 5. You do not need to give us a literature review about why maternal health outcomes are so poor. That is not that's not the interest of the implementation science journals. When you are writing for implementation science journals, make sure you're citing the key implementation science papers. So this, for example, thinking about what theory, model, or framework are you using? Make sure you're citing the updated CFR or the original CFR, I guess, depending on what you used, or the PRISM re-aim papers or the TRCD checklist. make sure you're citing those key papers. If you don't, and you move to review, you'll definitely get there. And I am seeing the time. I'm gonna hurry up here. Um, Implementation science journals have very generous word limits. This is for a research article. JIRA, you can see, has a bunch of asterisks. I asked Megan Lingfall is on the editorial board, and she said within reason, they'll accept most things. As you can see, Frontiers is 12,000 words. Who's going to read 12,000 words anyway? And then for formatting for most implementation science journals, as I mentioned, right, like this is the social problem, this is the practice gap, this is how we propose to address that, and this is how our study addresses that, right? Having that 3-paragraph introduction, sometimes a little longer, most of the time it stays in that 3 paragraphs. Your methods, again, look for similarly published articles, right? If you're doing a hybrid type 1 trial, look for another hybrid type 1 trial that's been published, results paper that's been published in the journal, and follow what sections they have in their methods, maybe plus or minus 1, depending on the thing. And then the results section, again, the goal here is not to reinvent the wheel with your headings and your sections within your results paper. And then also thinking about the discussion, right? This is pretty standard. The big distinction I would make here, this follows more of a health services research approach than it does some of the other academic fields that have a very long background section, right? Bringing in major citations from the theory and your theoretical justification and all of that. That is not typically how these journals work. Okay, so let's talk about the review process. What I have found is that, especially the top journals, Implementation Science and Implementation Science Communications, it might be a little longer than this, but desk rejections or editorial rejections happen relatively quickly. So you will hear, and then, if the editor doesn't like it for whatever reason, sometimes you'll get a rationale, sometimes you won't. And I've seen it go both ways. It can be really, really hard to find reviewers. I think this is across all of academics, and certainly the same is true for implementation science. Reviews can take anywhere from 3 to 6 months. They can take longer as well. So I think this goes back to that original point that I made, right? Is a peer-reviewed article the best way for you to communicate the information to your target audience? Again, we also think about the incentives we have. So for some of us, right, we're like, yeah, I know it takes a long time, but I have to do this, so we do it. So really thinking about that. What I have found is an initial review, getting those reviews back, responding to those. If you get a revise and resubmit, right, oftentimes you move to publication relatively quickly after that, if it's at the point of acceptance, or they tend to reject it relatively quickly. As I mentioned before, implementation science and implementation science communications are sister journals. I have had many occasions where it was desk rejected from implementation science. They said, hey, you could transfer it automatically to implementation science communications. And you say, great. And it's a pretty easy process. You upload a new cover letter and you move forward from there. The jargon can feel overwhelming. I've talked about this a bit. Relatively, most of the time, people are very welcoming and open, and they want to see your paper published. Reviewers will give citations. Yes, sometimes it's their citations, but oftentimes they'll say, oh, make sure you reference these, 3 kind of key papers from that field. We were talking about this in an internal meeting. Implementation science and implementation science have an open peer review process. And so you can see who reviewed your paper. It is public what they say, so you can go on the page, you can go on implementation science, look at any article, you can see who reviewed that article, and you can see what they said, and then you can see what the authors responded. People have feelings about that one way or the other. Let's see. This is a repeat side, so that's great. Desk rejections happen and they sting. It's okay. Don't take it personally. It is really, really hard to get published, especially in implementation science, increasingly in implementation science communications. Do not take it personally. If you receive any feedback, whether it's from the editors or from a reviewer, integrate that feedback, try again, whether it's in that same journal or somewhere else. Reviews can take a long, long time. My practice has been to give it about 3 months initially, and then I email very respectfully through the portal, through the submission portal, and then I tend to email like every 6 weeks to 2 months. And if you are, it's a bit like quid pro quo, which, you know, again, it can make people have feelings, but if you're asked to review an article by the journal you're submitting to, my practice has been to do it. Also, I think it's really, I find it really helpful to review what other people are writing. It's good practice, and it has helped me think about and better clarify, oh, this is how other people may be receiving that information. So you know, can I do a better job of being more clear? We have a few more slides, but if you have questions, please feel free to put them in the chat and I'll start answering them. Reviewers' comments can be challenging. Sometimes people, you know, it's writing, right? We don't hear the inflections. And so maybe someone really intended it to come across in a kind way, but it comes across in a snarky way. And that can be really challenging. My practice has been, especially if it's major revisions, especially if it got reviewed and then got rejected, I will read the comments, and then I will take a few days. I will walk around the block, go work out, or move my body, and then I will come back to it in a couple of days and read it again. Because, you know, it can be really hard, right? You poured so much energy into this paper, and then to get kind of rough comments back can be hard. Sometimes reviewers do not read in detail. Sometimes they misunderstand. It happens. Again, my posture is very much to give folks the benefit of the doubt. Please be gracious. Again, if you are doing this for implementation science or implementation science communications, it is public, right? And so what you write back to them will be put up on the website. And so, you know, take that for what you will. It's okay to push back. It's okay to say, hey, we really considered it, but for XYZ reason, we chose not to make this adjustment. That's totally, you know, you are within your right to do that. Sometimes it's really thinking about, okay, what is the thing I really care about, and what's the thing that doesn't matter so much? Okay, so your paper gets published. You should definitely celebrate. Please, if your work is related to improve, send it to us here at Amethyst. Send it to your COE. We will put it in our distribution list. I know social media is kind of all over the place these days, but there's LinkedIn. I think some folks are still on X. There's Blue Sky, op-eds. We have resources that can help. So, hey, I published this academic paper. Now I am ready to kind of share our results after it's been peer reviewed. I'm ready to share our results with the broader community. We have resources that can help you, and share it with your academic department. The final thing I wanted to, or resource I wanted to make you aware of, was this idea of Twitter posters. This came up. Oh yes, and Shelby put the op-ed template in the chat for folks. So this idea of Twitter posters came up during the pandemic, when a lot of academic conferences were being moved virtual. And so this can be a really great way to force you as an academic to summarize your research into a GIF. And then you can post it on social media, or you can embed it on, you know, your own website, or, you know, your COE's website, or whatever that may look like. So there is a how-to video that's on YouTube. That's the top QR code. And then there's a template that you can download that the animations to save it as a GIF are in there as well. So I think this is a great resource. It's something that, it's like I want to do it for all of my articles, and, then I don't always. And so this has been a good reminder for me to do that. Okay. So I'm happy to answer any questions. Some of the things that we here at Amethyst would love to think about is what resources, when it comes to publishing, either in the implementation science literature or as it relates to your improved work, would be helpful for us to provide. We're very open to thinking about what kinds of resources would be useful. What other additional questions as it comes to publishing do you have? And what other seminars, again, in this particular context, thinking about publishing would be most helpful? I think we're happy to do that. So with that, thank you all so much, and I am more than welcome